I thought it would be easy to show you how to properly get ready for your daily health check instead of trying to do an in-person training with all of you sporadically. I thought this might be helpful. So for those of you that don't know me, my name's Dory Demers and I am one of the school nurses at Milton. So prior to every start of a school day, whether it's ESY or our normal school day, every student is required to have what we call a daily health check. So this is what the daily health check form will look like. Basically, it has, all the questions that we need to make sure that somebody is well enough to attend our school day. So first off, you're gonna check, what the student name is, put the date, and then you're gonna ask them, have they been in contact with a person who has COVID-19? And then have they felt unwell with any symptoms consistent of COVID-19? So that would be fever, cough, shortness of breath, difficulty breathing. There's a whole list of them that we'd like you to go over with each of them. And then you would take their current temperature. And we also are asking you that you identify a point of contact today. So if by any chance that we need to get a hold of somebody in a quick manner, that we have the first person that we can contact and they can get to school rather quickly. And then, the best way to contact if an emergency arises. So is it their cell phone? Is it, call their work? Any of those things. So whoever's doing a screening will have a daily health check bin, which is right here. And in the bin, there's gonna be several different things. So you're gonna find some wipes, you're gonna find a pack of gloves, you're gonna find safety goggles, you're gonna find some hand sanitizer, and you're gonna find a non-contact thermometer. So I'm gonna run through really quickly how you would conduct your daily health check. So prior to the student arriving, the first thing you want to do is make sure your hands are nice and clean. So we're gonna use our hand sanitizer and make sure you get the fronts, the backs, the fingernails all over until the hand sanitizer is dry. Now that my hands are clean, I'm ready to don my mask. Remember, we want to keep all of anything dirty, so our dirty hands away from our face. That's why anytime we're going to come in close proximity with our face, we want to make sure we use that hand sanitizer or soap and water. So we're going to don our face mask. And I'm going to make sure I have a good seal around. So there we go. The next thing that I'm going to do is I'm going to put on my safety goggles. Everybody that's doing health screenings is required by the state to be wearing safety goggles during the screening time. So I'm gonna go ahead and put my goggles on, and these fit nice and snug. They are anti-fog. Now that I have, I'm done with the face region, I am going to put on my gloves. So I'm gonna carefully slide into my gloves. Just like so. For the goggles, the tighter the seal, the less that they're apt to fog up. So make sure that you're using this area to really pull these nice and snug so you have a good seal around your whole face. So then I am ready to conduct the health check. I'm hopefully either going to have a clipboard with my daily health check form, or I'm going to have a Google form that I can put it in via the iPad or a computer. So as the people come in, I'm going to start with asking those questions. So the first question would be, have you been in contact with a person that has COVID? So after I've gone through the questions with them, my last and final check is that I'm going to be checking their temperature. So this is just one of our non-contact thermometers that we have. It's very simple to work. There are 3 buttons on it. Once we get our other non-contact thermometer, I'll do a quick tutorial on how to do that as well. So this thermometer has a, you can see that is where we're going to be taking the temperature. There is a little person with a smile on it. There's a little home, and then there's this little thing that says memory. We're going to be focusing on the little thing with the person smiling. The home is actually, you can take a temperature of a surface by using this. But again, we are going to be using this person. All right, so I'm gonna try to attempt to show you how this is going to work. But what I'm gonna do is I'm going to start by holding and pressing this little smiley face. And I'm gonna line it up directly parallel to my head. And I'm going to hold it down and you'll see 2 dots. You see how you can see those 2 dots? My goal is to get those 2 dots to come in as 1. Once I get as 1, I know I'm at the right distance to take my temperature. And then I'm gonna release that button and it's gonna give me my temp. So I'm 97.7 again. So again, I'm gonna show you. You're gonna come in directly parallel to your head. So you're not gonna tip it, you're not gonna do that. And you're gonna find those 2 dots. Remember to hold that button, that little smiley face, and then you're gonna make those 2 dots come to 1 and then release. That's it. And you get your temperature. Again, I'm 97.7. Now the person is ready to move on to into school. We're gonna direct them to go wash their hands at a hand washing station and then they can go to class. So what do I have to do in between students? So if I'm screening multiple students, if I'm using a non-contact thermometer, you do not have to disinfect this or take off your gloves or anything. As long as you're maintaining, distance and you're not touching them, and you're just kind of going in that one time to do that, this doesn't need to be disinfected or anything like that. So you can continue to do health checks with this same setup. So at the end of the day, you're now ready to start taking off all of your supplies. So I'm gonna run through how you would do that in the safest way possible. So first we're gonna start with our gloves. You may be wondering why I wouldn't start here, and it's because these are considered now pretty dirty. So we don't want to come anywhere near our face with them. So to take off a glove in the safest way, you're going to hold a hand out and you're going to grab your little pincher fingers and you're going to pinch the glove. So remember, don't touch any part of your surface. You're going to pinch the glove and you're just going to take it off. And you can hold it in that hand. And then this is the trickier part, but this hand is theoretically, because we cleaned it before we put on our gloves, this hand is actually clean. So we don't want to touch this part. We actually want to go under the glove because we know that that part isn't clean or is clean. And then we're just going to flip it around. So it's almost like inside out. And we're never coming in contact with that dirty part of the glove. Now this is ready to be disposed of. Now that I have my gloves off, I'm just quickly going to do another little hand sanitizer just because, and I'm ready to take off the rest of my stuff. So I'm gonna go ahead and take off my eyeglasses. I'm gonna pull from the back and over. And then I'm gonna take off my mask. And again, we don't wanna pull off here. We wanna pull from our ears and then take it off. And your best bet is to fold it in half and place this in a spot that you're not gonna need it for a little while. Now, so after the day of screening, you are going to want to clean down all of the surfaces within that health kit. So you're going to clean down the non-contact thermometer. You're actually going to clean the bin as well. Make sure you clean your goggles really well and you should be good for the day. And then pop the cover on and it'll be all set. So that's how you do a health screening. So I'm going to go through some what ifs. What if a student comes and they tell you yes to either one of the first 2 questions? Yes, they've been in contact with somebody with COVID, or yes, they have a symptom like a cough, a stuffy nose, that they can't attribute to anything. So unfortunately, if they say yes to either of those, it's a do not pass go, do not collect $200. They will not be allowed to attend in-person learning that day. So what would happen is you would say, I'm sorry, unfortunately, due to your symptoms, or due to your contact with someone, you are unable to attend school day today. At that point, your role is to contact the administrator of your school and let them know, hey, I had to let this child go because they had symptoms consistent. From there, our administration will be contacting one of the school nurses, either myself, Evelyn, Roberta, to say, hey, we sent home this person, and we will be making a return to school plan with them of when they can return. For temperature screenings, if any student or staff member has a temperature that's above 100.4, they are not allowed to attend in-person learning. So it's anything greater than or equal to 100.4. And again, your job would be to contact the administration, and we would be making that plan with the family of when they can return. I know there are going to be many questions for this, and I know it's going to be hard to get used to this, and I appreciate you really trying to practice this. I would suggest, grabbing one of these kits. There's going to be several of them, and just practicing. If you're a health check person, practicing on some friends, and making sure that you know how to work the thermometers just right. If you have any questions, or if this wasn't clear, please feel free to contact me. My email is ddemers2@mymtsd-vt.org. So it's the D. Demers 2. If you do D. Demers, you'll send it to my husband, Derek. So make sure you put that 2 at the end. And like I said, if you have any questions or concerns, please let me know.